Welcome, everyone. It is now 1 o'clock. We are going to get started. We are going to ask everyone as you are entering the room, please put in the chat where you are joining us from. We would love to know the location. If you would like to put your health center, that is great. But please, if you get a chance, put in the chat where you're joining us from. And because we have a big day today with regards to this webinar, we are going to be respectful of everyone's time and go ahead and get started.
Okay. So let's get started. Thank you, Dr. Weathersby. I just want to say welcome everyone. Before we go to this slide, I just want to welcome everyone to Building Relationships and Screening Conversations. We are so happy that you're here to join in and listen to what this amazing panel has to share. We come with a strong panel of experience, both in public health, clinical leaders as well. And we're going to use this time. They're going to show you some strategies, teach you a couple of tools, strategies on empathy, humility, and intentional communication. Because we do know strong patient-provider relationships are the foundation of effective care and quality outcomes. And so communication is so important. And so today, you will walk away with a few tools and some real-world strategies on how to build relationships with your patients. Want to also state for your time today here, this is a CME, 1-hour CME accredited workshop. So please look for the link that you'll receive so that you can apply for your CMEs for the 1 hour that you're here. And without further ado, I'm going to get to this amazing panel. I'm going to turn it back over to Dr. Weathersby so that we can move through the next part of the session.
Thank you. Augustine, we want to make sure we click the yes so everyone can see the continuing education credit slide, as well as we want to make sure the disclosure. Thank you so much.
Thank you.
Okay, so let's go next to the next slide. So as Tanya stated, we definitely want to welcome everyone. We see here we have a full house, and we're so grateful for everyone that's joining us. Again, please use the chat. Let us know where you're joining us from. If you cannot use the chat, please send us raise your hand so we can figure out what's going on. We have a few people that's raising their hands. So I'm guessing everyone is having issues with the chat. Can we, oh, someone says they're having issues with the chat. Okay.
Yeah.
Thank you. Thank you for that. Let's figure out, we're going to get some people to figure out what's going on with the chat. Thank you so much for that. Actually, give us just 2 minutes because we want to make sure the chat is able and working for everyone because we want to make this as interactive as possible. So let me, give me 1 minute. Everyone, can we, let's work on this really quickly. As you're able to chat, if you can put your hand down, that will let us know that the chat is now working for you. As we know, technology these days, so bear with us. This isn't going to take that much time. And again, we're going to make sure all of your questions and listen to you today. And we want to make sure, again, this is how important the chat is. We want to make sure that everyone is heard. We hear your case studies, all of that. So we want to just take 1 minute out and make sure the chat is working. Okay, I see a few people, your hand is still up, and thank you.
So how about we use the Q&A? Does everyone have access to the Q&A? So you could drop your answers in the Q&A box. It's right adjacent to the chat feature. So we could continue, Dr. Weathersby,
Yes,
and we could certainly use the Q&A box
yes.
if
Is
we're
that
not
fine, everyone? Let's use the Q&A box. Thank you. Thank
monitoring.
you. Okay, everyone. Thank you for pivoting. As we know, technology, it happens. It's a blessing, and sometimes there's issues. So, um, by the end of today, you should be able to recognize effective strategies to really have discussions with your patients about cancer screening. We're going to do some interactive case studies in which you get to see real life situations of how to have discussions with your patients around cancer screening, especially if they're behind. So we hope that you learn different techniques with regards to building relationships with your patients and the community to get them interested in cancer screening. Okay, next, please. So our speakers today, we have three, and they are really great. They have been doing this in the field, in real life, talking, building relationships with this clientele. So we have Joao Bojon, who holds a master's degree in food and nutrition services, health promotions, and a bachelor's degree in biochemistry with a minor in mathematics. And she has over 15 years of experience with nutrition, education, community, healthcare, and research. She has led health education programs. And when you hear her speak about her interactions with patients, especially patients who have cancer and they're dealing with issues of trying to keep up with their nutrition. It is very heartwarming, and I can't wait for you all to hear her stories. And then we have Singay Galame, and she's from Decatur, Georgia, with roots in Cameroon. And she holds a bachelor's degree in biology. Also, she is a community health worker. And when you hear Singay speak about her interactions in the field, hear her talk about as a community health worker, what is needed, how can you help, how can everyone support community and through a community health worker's eyes. It's going to be enlightening, and we cannot wait to listen to Singay about her experiences, as well as Singay has background in global health. So she's going to put some of that information into her talk today. And then next, we have Dr. LaShanta Eberhard, who is a health equity leader and impact strategist with over 17 years of experience in public health. She is the CEO of Thrive Now Consulting, and she supports organizations with regards to social impact. And she believes in amplifying the community's voices. She has a diverse background. We met through academia, and she has spent a lifetime in helping people with regards to building relationships and just trying to really help people understand each other from the healthcare professionals to the community. So again, we have great speakers today. We cannot wait to listen to their stories, listen to them answer questions from you, the audience, as well as talk about some of the case studies that they have. But first, we do want to start off with a poll. So the poll is quick, 2 seconds, and we're asking everybody to do the poll. So technology should be working now. And we should see everybody be able to take the poll. So if you can, please, everyone in here, take 2 seconds and answer the 3 questions. And while we're doing it, I see the Q&A box. People are dropping in the Q&A box and telling us where they're joining us from. So thank you for all those that are doing that. And I see Busy Bee. Busy Bee, you're really in here today. I used to live in Houston, so I know a lot about Busy Bee. Again, if you want to, we're hoping the chat is working now, but if not, you can put where you're joining us from in the Q&A. Thank you. We're almost halfway done with the pre-poll, so thank you. And those that have done the poll and you're in the Q&A, we are asking you if you have a situation right now in your health center with regards to building a relationship with some type of patient and or maybe patients and you're having difficult situations, we're asking you to also drop that in the Q&A. You do not have to put your name or anything. You can be anonymous, and you can tell us the situation in the Q&A, and we'll make sure that the presenters address your situation when we get to our case study section today. So again, if you have a situation or that you would like us to help you with, where you have a group of patients or maybe some type of type that you're having a hard time reaching, building a relationship with, drop that in the Q&A. You do not have to put your name or anything, and we will address that during the case study section. All right, so we're going to end the poll. Thank you all that were able to participate. Okay. All righty, so now we're going to go to the actual questions of and hear from our panelists. So next, we have different themes today. So the first theme is foundations of relationship building. Okay, so if you have again a question, a situation, anything around this theme, please, we're thinking the chat is working, but if not, you can drop it in the Q&A. And we're going to start off with Hawal. So, Hawal, the question is, what are practical ways to build relationships with patients during the first few minutes of an appointment?
Thank you so much for the intro. So just to get to it now, the first thing before you even see the patient, time is a factor. What time are you seeing the patient? If it's early in the morning, that might not be the best. You want to catch them at a time that you're able to have their full and undivided attention. So probably before lunch. And as an RD, if you go to them during lunch, that's a good thing. You get to observe how they're eating. So it will give you some answers and insight on their nutrition habits and what's going on. And so going probably in the mid-morning, and also you do want to, oh, did they just come back from getting some tests done or getting a procedure? That might not be the best either. So just go bait and also observe the mood of the patient. And you too, going with the energy that you're excited to see them. You're happy to see them. The patient will read your energy. Honestly, they're like, okay, this person, don't go in such a serious phase. Go in with a smile, lead with a smile, and it goes a long way. And of course, definitely introduce yourself. Make sure you have the right patient, asking their name. I'm here to so, what department you're coming from. So most time for me, I come in with just a fun, engaging, and I always tell them that, oh, I'm here to get you fed and nourished. And once they hear that, at first it's like, huh? What should be? And I let them know I'm coming from nutrition. I'm the registered dietitian. Having your set of questions, being attentive goes a long way. Being intentional, have your questions that you're asking. Are they, like I said, for me, I cover the oncology floor. And so most time with patients that are dealing with cancer, mucositis is an issue, low appetite. So I come in to try and increase oral intake. So that's why I come in like, what's going on? Is it a chewing issue? If it's a chewing issue, then you know that, okay, you might need to send them a mechanical soft diet. Is it a swallowing issue? Then you might need to refer them to someone to test them on the swallowing part and give them opportunity to also ask questions, culture-wise, language. Do they speak English? Or is there a certain language that they speak? That if you need interpreter, then that's where you call that in too. So these are things you have to think about. Reading their body language. Are there any wounds on the person? Are they in pain? This could affect the communication you have with the patient. If they're in pain, they might not give you their undivided attention. When you're dealing with pain, you don't really want to see anybody. They've already had so many healthcare professionals coming in there. So being respectful of their time, being just considerate of how they're feeling, just being, having empathy. And even asking, so how are you today? That question is powerful. How are you? How many is asking that question? Even just just walking on the road, how many people ask us that question? How are you today? Genuinely, and ask it that you mean it. How are you doing today? How are you feeling? So when you open with that, a lot of the time the patient starts to just talk. Just get how they're feeling first before you dive into why you're even there. Get a feel of what's going on, and just, are they in happy mood? Are they in happy spirit? Are they in pain? And then talking about, like I said, being just respectful and giving them your undivided attention. You shouldn't be on your phone. You really should just be focused on them, making eye contact with them, and just like, oh, I hear you. I see you. Validating their experiences, understanding their emotions and where they're coming from. These feelings, these connection, it goes a long way, and it makes the patient feel seen and heard. Who doesn't want to feel seen and heard? Who doesn't want to get their concerns? And if they even have something bothering them, let them just talk about it. Let the patient just talk about it. It goes a long way. Like, just get it off your chest. It might not even be related to what you're coming in to see, but when you build that, it's part of building trust. Building an opening space that they can be comfortable and they can trust you with the information that they're sharing. And I always let them know, like, this, you can be honest with me. It's okay. No judgment. Create that no judgment space for the patient to just tell it all. And so being, like I said, being present, actively present in that room, so that one is the attention, being very attentive, no single distraction. The patient is your sole focus. Nobody else is in that room but that patient, and you're giving them your full attention. You see them, you hear them, you're with them, you stand by them, you're here to support them. You don't want to also make statements such as, for example, oh, I see you're struggling with your diet. No, that's not something you want to typically say. You can say, oh, let's talk about your food choices and how we can build on your healthy eating habit. Focus on the positive. Do not focus on the negative or the challenges they're going through. Let's focus on the positive. How can we build on them? Patients love that and they appreciate that. And then, are they having bowel movements? So have your set of questions that you're going to ask the patient to get insight on their nutrition, their eating habits. If they're not having bowel movement, is there constipation? Are they experiencing diarrhea, nausea, vomiting? These are ways that will prevent you from eating. If you're experiencing vomiting, you're not keeping the food down. Eating is a big part of healing, for the patient. It definitely speeds up the healing. So if they're not increasing their intake, they're not eating, that can be problematic, and that can slow the body healing from what's going on. And even with the intake, factor in their cultural perspective. Like, okay, this person might be Nigerian, or the person might be from Cameroon, the person might be Tanzanian. All right, let's incorporate for Tanzanian food. Let's incorporate pilau. Let's incorporate chapati. When you know about your cultural diet, it's like, oh, wow, this person really gets me. This health provider is all about me. Is it jollof rice that they like as a Nigerian? Okay, how can we incorporate that? Now, I always let them know I understand hospital food. I do put out the disclaimer, might not be the best, and I definitely understand that. But how can we make it more interesting for you and making you want to eat the food? Because food is like it's psychological. The view, the presentation, how it looks, the color, it goes a long way with the patient. If it doesn't look appealing, the patient will likely not want to eat. And so coming from a place of servitude, that you're here, you support them, you're here to support them in their journey. Ask the question of, what do you need from me to support you in your journey? That's a powerful question. Like, what do you need from me? Don't make assumptions that you know what they need from you. Ask the patient, because make it an encounter that you're both in this together versus you telling them what they should do. No, we're in this together. We're going to figure it out. I'm going to support you. What do you need? So these are just, like I said, these are just some tools to use with regards to building that trust.
Thank you. Wow. Any other panelists, do you have anything to add to this theme question?
Yes, I can go. Good afternoon, everyone. For me, again, as a community health worker, I'm a complete stranger to this person. This person's never met me a day in their life. Of course, all I have based on what they're giving me is what the provider gave me. And in this time period, again, you have to think and have empathy because you have no idea. I mean, you know what they're going through and you know what you're about to walk into, but this person has no clue that you know what's going on with them. So I think it's important to have empathy and consideration for the person that's in the room and to create a safe environment so they feel trusted. These people have probably been sitting in the room for hours, waiting and waiting, probably frustrated, probably feel like they're not going to be seen, feel like they're not going to be heard. So it's just best that you just have the empathy, create that environment for them to feel safe, let them express how they feel, and let everything out. And then from there, move forward to what you are supposed to do. Because once the person feels confident and comfortable within, that's when everything comes out. And that's how you find out more information that they didn't even tell the provider because the provider didn't make them feel like what they're saying matters. And for me, being the person that bridges the gap between the patient and the provider, that's where I step in.
Thank you. Thank you. We're going to move on to the next theme. And we see that there's a lot of people that have joined us. For those that have joined, apologies with the chat, but please use the Q&A. It's a little square at the bottom with a question mark in it. We're going to ask you to use that to ask our panelists questions and to also tell us about any situations that you are dealing with. So again, we're asking you to use the Q&A button at the bottom of your screen. Thank you. So for the second theme, and this question will address listening and empathy in screening. So how do you identify and respond to hesitation or resistance from patients about screening? I think this question is for you, Singay.
Okay. Yes. So again, this is something that definitely this stems from, like I said prior to creating the environment for them to feel comfortable. Because by you setting that the environment for you for the patient, then as you're moving forward to discuss, okay, well, this is screening we're talking about, and of course the client's going to come with all these theories that they found off the internet or what their friend told them or what such and such said, or they don't believe what this person said. But for me, being the trusted messenger, I have to find a way to filter the dialogue and make sure. And another thing that's important to know is understanding who you're speaking to, because you have to use your wording and dialogue because everybody doesn't understand certain words, certain terminologies. So with studying the person of who you're talking to and being able to provide that dialogue to where they're able to understand and explain to them that, you have to make sure that it's from a credible source. Everything from the internet is not a credible source, and giving that explanation and demonstrating how to review and read if something is a credible source.
Thank you. Any other panelists would like to jump in on theme two of listening and empathy and screening?
Hi, everyone. I would like to add something. Can you hear me okay?
Yes, yes.
Okay. Yeah, I would just piggyback on what Singay said. I think as a social behavioral scientist, some of the things I'm going to pick up on is connecting to body language, and so their behavior. So I would look and observe and ask that the clinical staff consider some of those nonverbal cues that might come across. um, we talk about staff having an openness to their body language and also thinking about their tone, but thinking about the tone and the body language of the patient as well. Are their arms crossed? Is there a lack of eye contact when you're trying to make contact? Where are they sitting and how are they sitting in the room? Also listening for some of those even verbal cues that they may have. Is there any cues of uncertainty, and that you want to assure them of some of the um, and help them with their hesitation when they're asking questions about like the need for this, but validating their feelings, just like you're validating cultural background and other things, and clarifying any of those that miss information that might come forth, or helping use some techniques that you might be able to use, whether it be motivational interviewing or some of those things. Just making sure you're paying close attention to the patient and what is coming across in their body language and also in their verbal language.
Thank you. Thank you, Dr. LaShanta. All right. And again, those that have joined, please put your questions in the Q&A box. We're going to move on to the third theme, and it's about power dynamics, microaggressions, and biases. So how can providers create a safer space for open dialogue and high stakes or sensitive screening discussions? So this is for Dr. LaShanta. We're going to ask you again, this theme is power dynamics, microaggressions, and bias.
Oh, this is a great question. I would start by like highlighting and piggybacking on a little bit of what I said earlier, but connecting to the empathetic side as a provider, leading with empathy, but also curiosity, so that you understand why you might get some of those um, different body languages or nonverbal cues that you might pick up on, and making sure that creating that safe environment, it also means tapping into the information that you know about the patient, and that what you don't know about the patient, and what you know about not only the patient but also yourself. So this is, I think, where you have to consider your own implicit biases that come into place, and how what you know about the patient may influence your interaction, and not create a safe space for patients, because you think about the sensitive nature of screening discussion and screening overall, especially for any population. But it is a sensitive subject. So I think, knowing, coming in armed with information about the patient, but then utilizing that conversation to get to know the patient more. What are some of their values? What are some of the things, their cultural, their social norms that you might not be familiar with? You never want to assume what those things look like. And that will help you to build a rapport before you just jump into a conversation, whether it be about screening or any other factor with regards to their health. But I think also providing space for questions that don't lead to judgment, right? And so that might look like welcoming questions and making sure your tone is appropriate and making them feel comfortable, even if they don't have the language for it. Finding that, meeting them where they are in terms of their understanding of the screening discussion. And making sure in some instance you can normalize without stating fear, but normalize that fear or hesitancy, in the sense of connecting them to other patients and recognizing you're not feeling these emotions, or you might have questions about things, and you're not the only one. There are other patients that come in with similar questions, um, but I would lastly say, considering the fact that if there is something that the patient shares, making sure you clearly understand what they're asking. So listening and really kind of re paraphrasing what you've heard from the patient, so that you're clear on what they're asking, how they feel, to make sure they can make an informed decision about how to whether to have that screening, because this is a high stakes discussion and you want to make sure they feel comfortable and they don't feel pressured to make a decision.
Yeah. Thank you, Dr. LaShanta. A lot of things that you mentioned is actually a part of health literacy, where we tell patients, we tell providers, do not let a patient leave the room unless they ask you 3 questions. So the Ask Me Three campaign is really huge in relationship building. It lets the patient know that you trust them to ask you intelligent questions. It builds relationships when you know what exactly their concerns are. And then also that patient is leaving with some type of knowledge with those questions that they answer. So thank you. Any other panelists would like to address this theme of power dynamics, microaggressions, and bias with regards to this question. Any other panelists?
I would say, so just to add, now there's the part of looking at the patient, maintaining eye contact, it's also a tricky one too, because there's certain cultures that maintaining eye contact is not is not the norm. And so that's where, like my colleague said, just being aware of the culture, because and you might think the person, oh, they don't want to look at you, and you're thinking, okay, why doesn't this patient want to look at me? But it's not
Mhm,
that, it's also a culture.
mhm.
And so you want to, be conscious of that. Certain things that work for certain cultures might not work for the others. Know the difference.
Yes, exactly. That is a very intense type of training of really learning your community by learning everything about that community, how uh, they like eye contact, how do they like to be spoken to, etc. So that is a deep dive that, we will hope that other people are able to do with regards to learning their community, learning the ins and out of what that community prefers. Um, so I want to again make sure everyone knows that they can use the Q&A box to ask us any questions. We've gone through 3 themes so far, and we're going to go into case studies. So if you have a situation right now in your health center where you have certain patients that you are just having a hard time connecting with, we're going to ask you to please put that in the Q&A, or you can raise your hand and we can unmute you and you can speak. So if you would like to ask a question, if you would like to tell us about what's going on in your health center, please raise your hand. Let us unmute you. You can talk. We're here to help each other. So while everyone is thinking about if they want to speak or not, we're going to move on to the first role play case study scenario. So we have a situation. This is case study number 1, and this is Ms. Johnson. And Ms. Johnson is a 52-year-old African American woman. Her visit is with regards to hypertension follow-up. So again, her attention has nothing to, it's not about cancer. However, while you are going over her chart, you realize that she is overdue for a mammogram and colorectal screening. Understand that she has past experiences with painful mammogram, distrustful of the medical community, and she really has issues with some medical communication. So this is the first case study, and we're going to turn it over to our panelists to pretty much act out how to address someone like Miss Johnson. So I think it's going to be Singay and Lashanta for this case study.
Yes. So good afternoon, Miss Johnson. My name is Dr. Eberhard. How are you today?
Okay, how are you?
I'm doing wonderful. So I'm glad that you came to see us today. I know we're kind of here talking about you're here to for a follow-up hypertension. Is that correct?
Yes, but what's hypertension?
So hypertension. So before I answer the question about hypertension, I want to um, ask you first. Have you ever had a discussion with any other doctor about or a nurse or anybody, has anybody talked to you about hypertension, like in our office besides me?
I, I mean, as long as I know what hypertension is, I probably have. I just don't know what it is. I've never heard that word before.
So maybe the best way for me to explain hypertension is it's definitely a medical condition, but a lot of times what you see in hypertension is a higher level of blood pressure. Are you
Oh,
familiar
high
with
blood
that?
pressure. I know that. I know that. Yeah,
Yes,
that's the word I
right.
need. Yeah, I know that.
So hypertension is the medical term for
Okay.
high blood pressure, or sometimes you might hear it called high BP. Okay, but
Okay.
hypertension is that's what hypertension is. So we just want to we you're in here today for us to kind of talk through a little bit about your follow up with regards to your high blood pressure. So we'll use that for the remainder of the conversation. Will that be helpful?
Yes.
Okay, great. And let me ask a few questions about that because I know you're asking me about what high blood pressure is. Do you have any family history, or do you know anyone else in your family that has experienced high blood pressure?
Oh, yes. My husband, his family, my family, everybody. It just runs in the family. Yes.
Okay. So I think it's well, I'm glad that you know a little bit about your history with regards to high blood pressure. Um, do you have any history in your family, or have you ever had? Well, I'm looking at your chart here, actually, excuse me, and I see that you've had some um, other visits to the doctor, and then in those visits that you've had some screenings and things like that. Tell me a little bit about your experience with that. I want to hear it from you rather than just reading something off the page.
Well, it's some machine. I mean, they said I have to come and it's yearly and it's supposed to make sure I'm okay. And yeah, that's all I know. That's all I can understand from what they told me.
How did you feel when having those screenings? Did you feel comfortable? Did you feel like you left with the information that you needed to continue those things? Because I want to make sure that you have the information you need and you feel comfortable.
Well, I mean, it's already hard to get to the appointments because, I have to take time off of work and I have my grandkids. And then, I have to figure out how they're going to get there and how I'm going to get to my appointments, then trying to maintain the appointments and have the money to pay for the appointments and the money to pay for my blood pressure medication. So it's a lot to handle at the moment, but I try the best I can to make it through.
Yeah. I Miss Johnson, I definitely understand. I think what you're kind of talking about are some of those contextual factors, so things that surround patients. I mean, I have similar things, right? When it comes to things that surround and affect me, even getting here to work to see you. But I think those are all things that are important. They help me understand why, one, that you see it's important for you to have a follow up with your high blood pressure. But it also sounds like you are open to having these screenings, but you just have to make sure you have the resources and information to make sure you can get to the appointment.
Yes.
Is that correct? Okay.
Yes.
Well, I want to make sure before you leave here today that you have the information, not only some resources to help you, make those appointments, but also make sure you can get there and get there safely. Find out what resources that we have that exist that we might even be able to share with you. But furthermore, that you understand the importance of the screening. Um, Miss Johnson, it goes without saying, you're 52 years old, you're an African American woman, and it's really important that you have your mammogram routinely. Not only that, that you also have other important cancer screenings so your colorectal screening, your mammogram screening, because just looking at your history, some of those things are missing. And I want you to understand how important it is that you stay up to date on those because I want to see you in the doctor not because of something, because those were missed, but because I just want to see your face, right? And make sure your health is maintained. But we also see the same thing for other family members, and you can share that information with them. Was that helpful? Would that be helpful?
Yes, it really would. Thank you. I appreciate the help and the resources will be greatly appreciated. And I can share it with my coworkers and my family members who probably need the same help as well.
Wonderful.
All right. I think we're a scene. Thank you. Thank you. Um, I our panelists deserve an Oscar. So I do want to hear from you all in the audience. What is it that you would do if you had Miss Johnson? I'm sure you all have experienced a Miss Johnson type. of person. I see heart emojis going up right now for the panelists and their acting. Can you, who would like to unmute? Anyone would like to put in the Q&A? Who has a Miss Johnson in your health center right now? So anybody would like to talk? Yes. Okay, we got someone raise their hand. Let me unmute you really quickly. Give me 1 second.
Hello, can you hear me?
Oh, there you go.
Yes, hello. My name is Auni. I feel like it'd be beneficial to maybe go over the patient's diet, Miss Johnson's diet, what's contributing to that higher blood pressure. It does sound like she has a lot of things going on in her life. It could be stress, but I feel like it'd be good to follow up with her. How does the blood pressure medication make her feel? Is it that there's side effects there that maybe she could work towards bringing down the blood pressure through changes in diet, where that she can maybe even get off of the blood pressure medication, kind of to focus on that kind of part of the visit.
Great. Thank you for that. And I'm so glad that you brought that up. I had a situation with my grandmother where she was attending a health center that had rotation of, I guess it's medical student interns. And every time she got a new medical student, they put her on a different type of blood pressure medicine, but did not tell her to stop using the other medicine. So she had a purse full of blood pressure medicine and did not know she was supposed to stop. So again, clear communication about, okay, this is why you're taking this medication. This is why this is important. And again, I'm bringing up health literacy. We're going to talk about that sometime in the near future with regards to a webinar. But this is why it's very important to also do a brown bag medication appointment where you tell all your patients to bring in their medication, discuss why they are taking them, and then also ask them different scenarios of what is causing them to take that medication. As you mentioned, blood pressure. What other stresses do you have? Did you know that, worrying about your grandkids can cause your blood pressure to go up? Is there someone that can help you with what your grandkids, etc. So you brought up a great point. Thank you. Anyone else would like to get off mute, put a situation they're dealing with Q&A, with a patient? We would love to hear from you in real world scenarios of patients. We do have another case study we can do very quickly, but we just want to make sure that we heard from you all first. Okay, well, we're gonna move into um, the next. We did a debrief, so the next. Yes, thank you. And so this is case study number 2. This is with Mr. Lopez. Mr. Lopez is the 60-year-old Spanish-speaking farm worker. He's there for a routine checkup. He is overdue for FIT testing for colorectal cancer, and as well as his concern is fear due to wife's recent cancer deaths, and avoid screening. So we can I don't know. So Hawal and I think Singe, if you all want to do this scenario. So we have Mr. Lopez, and he is a 60-year-old Spanish speaking farm worker.
Okay. Hola.
Okay. Habla inglés?
Mm. ¿Cómo estás?
Okay. Well, what I'm going to do, I know this is probably not gonna translate well. I'm gonna use an app. We have what we have here, an app where I'm able to speak to um, the organization that can translate our conversation.
Sí.
Okay. So, okay, so we're gonna pretend that I'm talking to somebody who's gonna translate what I'm saying. I'm like doing two roles at one time. Okay. Um, so, good afternoon. My name is Senge Galame. I am a community health worker, and I am here we're going to talk about a screening that you'll need. Okay, so I just told this to the translator, and the translator is actually going to speak this in Spanish to the patient. So we're going to pretend like the person just spoke in Spanish to our patient.
Sí.
Okay. And so I'm speaking back to the translator, and I'm pretty much just explaining to the translator that um just learning more about the patient, understanding what it is about the screening that they're unable to do. And so as I'm doing that, the translator is asking the patient about their health history, and the patient is going to explain the health history.
Pain, painful, farm work, body pain.
Okay. So the patient is saying, so for me, then I'm asking, when is the last time you've seen a doctor? The last time have you had time off from the field to actually get assistance?
No time.
Okay. So then I would ask if there's a way that you're able to speak with your employer on having to figure out time to get off work, or just getting resources or assistance with being able to see a provider, because I know you have to work in the field and provide for your family, but figuring out if there's a way, or probably a clinic or somewhere nearby the field, maybe if you're taking a break or something, to be able to be seen.
Sí. We talk to employer.
Okay. So what I'll do, I'll make sure that I provide materials in Spanish for resources that are within your area that can be able to help you. And if you need any, like, probably assistance, like with insurance or anything else, or just seeing a provider, I'll also make sure all that material is in Spanish as well. So
Y,
the translator is saying all this to the client in Spanish.
screening, it scare me. It's scary.
Yes, it can be scary, but we want to see you live well. We want to make sure you're able to provide for your family and also live a long, healthy life. So taking these steps will help you to be able to live well and also function at work daily.
Wife, go because of screening.
Be, because you need it to make sure that it's a proper screen that you do at period. Well, it's a screen that you do to make sure everything's okay. Because
Mm.
you don't want to go to work one day and you don't know what's wrong. So by making sure you do this, you're able to function and do what you need to do daily.
Oh, sí, comprende. Oh, gracias.
All right, and seeing, thank you both. One thing that I definitely want to hop on is one thing that Singe did, which is with regards to going to a translator first. So, as we know, part of, again, health literacy, culture, competency, building relationships, period, is using a proper translator and not using family members, using a neighbor, using even a front staff medical person, but using a proper certified translator. And that's due to also building trust. You do not know that person's relationship with the front desk person. You don't actually know if the family member is properly translating to the patient. And so again, kudos to what Singe did with regards to properly getting a interpreter that is interpreting the correct information to the patient that they understand. And so with this also builds relationships with regards to trust. All right. Anyone else from the audience have a situation where you have a community of those with language barriers and you have a hard time getting them to get screened with regards to cancer? And again, you can put it in the Q&A. You can unmute by raising your hand and we can unmute you. Okay. If not, we'll move on. Wait, do we have something in Q&A? I just want to make sure. Oh, we have something in Q&A, and this is for the panelists. What about after hours appointments to include weekends made the patient the center of the need? So panelists, have you seen relationship building with regards to health centers, et cetera, having after hours appointments, including weekends?
I've seen that in more of a rural health center, not in a primary hospital setting, but I worked in Charleston. I volunteered at a rural health center, which primarily served um, Spanish speaking populations. And because of the work schedule, those contextual factors, some of the things that were even role played, they did provide additional hours. And they had certain doctors that would cover during the week, and then they would have weekend hours as well. Furthermore, they had volunteers, like maybe one or two volunteers that actually was nearly fluent, if not fluent, in Spanish. And they had a physician that was too. So that physician, they would make sure to trickle his time between the week, but also on the weekend. So that's what I've primarily seen. I don't know about the other panel.
I would say I've seen, yes, weekend coverage, whereby in terms of for dietitians, there's somebody that covers weekend and then you shuffle your hours during the week. You might be off on a certain day, but and what is covered over the weekend, probably new consults and just high priority type of consults, still providing that patient engagement and showing that our patients are, like I said, meeting their needs and everything. So for me, in my experience, we definitely tend to have weekend coverage. That's part of the work schedule.
Thank you.
We have one more
Thank you.
question. Okay.
We have one. Yes, yes. Would you like to read it? Oh, it's more of a comment. The comment is maybe focusing on the things that are important to the patient and how the cancer screenings can make sure the patient can still participate, can help the patient move past fear of screenings or bad results. Yes, that is a great point. Also, that helps move past fear with regards to various patients is also understanding what that fear comes from. There are certain cultures that fear is pretty engraved. You know, their generations have talked about that same thing. And so that goes with really building that relationship with that patient, really understanding what they believe, why do they feel this way, etc. So it's not just a, oh, that's silly. It's okay, can you tell me more about this? Why do your family feel like, this is hard, this is bad to have someone take your blood, or feel that it's bad for you to send your test results in the mail. So those are things that really get down to, again, building relationships. Also addressing fear is by really getting to know your patient and their culture. Yeah, so it looks like we are about time. If you do have other questions, feel free to send us an email. I'm going to pop this over back to our communications director. Oh, wait, I'm so sorry. Before we do that, I do have a one more poll I need everyone to take with regards to just what you learned today, and I'm launching it right now. And it's only going to take, again, 2 seconds. It's 3 questions. We're going to ask, please, everyone, just take 2 seconds to take the poll. But while we're doing that, I'm going to ask our panelists to please, if you can give us 1 point each that our attendees can leave here today with. So what is something, just one great point that you will love our attendees to know as they leave here today? So I'm going to start with Hawal.
So I would say, being intentional, create a space with, like I said, from a health educator standpoint, and even as a healthcare professional, just create a relationship that fosters trust, communication, and positive patient outcome. Create a supportive, compassionate environment, and just lead with a smile. Showing the patient that you're happy just even getting to talk with them. It goes a long way.
Thank you. Singe, what is 1 point you want to leave today with our audience?
Remember to have empathy. Remember, imagine if that was you in that position. Imagine that's your mother, your father, your cousin, your sister, whoever. Treat them the same way you would want to be treated.
Mhm.
Yes, thank you. Dr. LaShanta, what is one thing you want our audience to leave here with today?
I would say to make sure you're fostering a meaningful interaction with the patient, which taps into what both of my colleagues have said, but you're leaving the patient feeling supported and understood so that they can make a decision about screening, and not just the screening, but continue to make wise and informed decisions about their health.
Thank you. Thank you so much. And thank you, everyone who took the poll. I'm ending the poll now. All right, I'm going to turn this over to our communications director, who's going to talk about our next 2 events. And thank you so much for joining. So here you go, Augustine. And I think while we're doing that, also, Jessica's able to put the chat or maybe in the Q&A, the registration codes. There you go.
Awesome. So group, we have some exciting meetings upcoming, starting with Outreach That Works. This will take place tomorrow, actually, July 30th from 12:30 to 1 p.m. Jessica's going to type in the chat a link to register, so we hope to see you there. And then we also have partnering with colleges and universities to fill staffing gaps. This will take place on Thursday, July 31st at 1 p.m. So again, some really exciting events to come, and we hope to see you there.
Thank you so much, Augustine. And we are at time. We will be sending follow-up emails with regards to information. Thank you again. We hope to see you tomorrow as well as Thursday with a lot more information. We cannot wait to share. Thank you again, and you all have a great day. Thank you.